Hello everyone, welcome to the ICRS Patient Registry Workshop. My name is Gwen Towie, I'm the Registry Manager and I'm going to be leading this workshop today. Mike McNicholas, who's the chair, will be joining us soon, but he's held up in theatre at the moment, so hopefully he'll be joining us in a few minutes' time. But you will be stuck with me for the majority of the workshop, so hopefully you can understand my accent and you'll hopefully learn a lot from this experience as well. So just got some housekeeping to start with. So we do have a Q&A function in this Zoom call. So if you do have some questions today about what I'm going through, then please do ask a question. We won't answer them straight away. We'll wait until the end of the workshop to get through to those questions, because there might be some questions that I answer as I'm going through the workshop today. So I'd like to thank Anouk, Vanessa and Stefan at the office for helping organise this event behind the scenes. They've done a lot of work and it wouldn't be possible without them, so thank you very much. Also, after the meeting, this session will be on demand and it will eventually be put on the YouTube channel as well. So if you do have to drop out at any time, then you can catch up at a later date, and we'll be sharing that with you via email. We'll also be sharing the links that we show you today, just so you can access those quite easily after the webinar. So there's no need for you to write down all the links or write down any information that I tell you today. So hopefully it'll be fairly straightforward. So this webinar is for anyone who uses the registry and also people who are interested in using the registry. So we're going to start off with the very basics. So what I'll do is I'll share my screen and hopefully there won't be any technical issues. So hopefully someone will let me know if they can't see the screen. So what I want to tell you first is how to sign up to use the registry. And there might be a lot of you here who have already done this and might not be useful information for you, but if you haven't, then this could be quite beneficial. So to enroll in the registry as a user, all you need to do is sign on to the website, so that's cartilage.org, and then under society here we do have a page specifically for the registry, and you can find the sign up page on that web page. So this is what the sign up page looks like. It's very straightforward. The top of the page is for surgeons or clinicians. So although this says surgeon, anyone who has a duty of care for a patient can actually sign up with this form here. And then this, you can submit using this button, and this will go directly to Amplitude. And Amplitude are the hosts of the registry. And once they get your application, they'll just check that everything's okay, and they'll set up an account for you and then send you a link with your username and a password. The nice thing about the registry is that you can actually have delegates as well. So if you're a busy clinician and you don't have time to check up on every patient and include all the patient data that you want into the registry, then you can delegate this to another member of staff. So this can be a clinical staff, or it can be a research nurse, for example, or other support staff that you work with. So if you want these individuals to help you with inputting your data, then you can ask them to fill in this form. And the only difference is between the form is that they have to get themselves signed off by one of the consultants or clinicians that they're working with. So just an important point to note, you can't have a delegate working without a clinician. So you have to have all the clinicians that they're working with already enrolled in the registry. So as you can see, there's a big box here for which consultants the delegate's working for, so they can work for multiple people. So if you're in a large hospital with lots of clinicians wanting to put data in the registry, then this individual could do that for all of the clinicians. And again, that's submitted through here, and that again goes straight to Amplitude. And they will vet it and just check with the consultant that the person is who they say they are, and then they will get their own login, which they can use to access your patient data and whoever's patients they're also in charge of. So it's very straightforward to sign up. For the patients, again, it's quite straightforward. There's two ways that the patients can log into their portal. So the first is via the ICRS website. So there's a tab in the main website, if I go back here, for patients, and that'll land on this page. And there's a big yellow button here to access the ICRS registry. And this will take them straight to the patient portal, which looks like this. You can also get patients to access this patient portal via QR codes, which we can send you, that you can either print out and hand out to patients directly, or you can hang them in your clinic walls so that patients can scan them while they're sitting and waiting for their appointments. So this can be used on desktop, laptop, smartphone, tablet, anything really that has browser function. And what I'll do is I'll just quickly go through this so you can see what the patients see. And also then later I'll show you how you can search for this patient in the registry. So top right hand corner, the patients can change the language, which is quite useful because not all patients will have English as their first language, so they can choose their preferred language here. And the entire patient portal will then be in that language, including the consent form. So one of the reasons that I'm showing you this today is because we would like you to encourage your patients to enroll themselves in the registry. And there are two reasons for this. The first is so all the patients, oh, I just got a notification. So all the patients will be consented through the portal here. And if you don't ask them to enroll themselves, you will have to consent them manually yourself and add that into their patient records. So it is easier to do it directly through the portal. And also, if the patients are doing it through this themselves, it's one less of a job that you have to do. So you don't have to put in the patient's name, address, and all that information. It's already collected by the patient. So what I'll do now is I'll just quickly show you what it would look like for the patient. And I'll just make up a patient in the test portal. So I'll put this as surname, then workshop. Okay, so we want to search for the surgeon first. So it is important that the patient knows who their clinician is, otherwise they won't be able to link themselves to your portal. Okay. So then they get asked to put in a password, and this is just so that they can access the portal again after the treatment or the operation. So now registered on the system, and they can click continue to add some more information. So I would recommend that you tell patients to put their email addresses in, because this is how we contact them to do their follow-up questionnaires. And if they've got information on their local hospital numbers and address, they can put that in as well. So then you'll see the patient consent form, and I'm not going to go through this. If you want a copy, then you can ask me by email, and I'm happy to provide you with a copy. So as I said earlier, this will be in whatever language the patient chooses to use the portal in, and they agree there. So the consent form is fully GDPR compliant and can be used internationally. So next, this is the landing page they get to, which tells you that they haven't completed some of the questionnaires. So these are the routine questionnaires we ask the patients. So it'll first ask them about the injury, so you can say whether they suffered an injury or not. And as you can see, the option that they choose then depends on which questions they get asked. So you can also see that some questions are red and others are black. The black ones are optional and the red are mandatory. So they can say here whether they've got specific injuries that they know of. If they've had previous surgery, they can give details. Otherwise, they can just click no. And then it asks them some information about themselves. So again, this is in metric and imperial, which is nice and flexible for patients. And then they get asked whether they have pain behind the kneecap. And this then determines whether the patient gets asked the Kujala score at the end. So for today, I'm just going to say that there is. And then you'll see that this is the EQ5D. So I'm just going to click through these quickly because I'm sure you all know what these look like. And it's very simple for the patient to use. The other nice thing about this is if the patient closes the browser, if they're busy or get disrupted, then it does save their progress. And next time they log in, they can finish where they start off where they finished earlier. So they don't need to start the whole process again. Also, if you're in the clinical portal, which I'll show you in a moment, that's what you'll be able to see as a clinician. You'll be able to see if a patient hasn't finished their questionnaires, and you'll be able to send them a reminder if you can see that they haven't finished something that they should have. So I'll just click through these quickly. So we're now on the KUS score. So this is the other one that's routinely measured by the registry. And then the Kujala score. So I'll just run through these quickly. Sorry, this is quite tedious for you, but it's just useful for you to see what the patients would be seeing when they actually fill in the scores. So now they've completed the scores and there's a nice green tick. So that's all the patient has to do. Now we'll go into what you would be doing as a clinician. So when you get access to the registry, you'll be given a username and a password to sign in. I'm going to be using the test instance today, so it's exactly the same as the live portal, just won't actually contribute to the data that we have in the actual live registry. So just give me a few seconds just to remind me that this is a test system, and eventually it'll come to the landing page. Okay, so if I'm here as a delegate, and this shows me that I work for a number of surgeons. So if you are a delegate, you will get greeted by this page and you can choose who you then log in on behalf of. If you are a consultant or a clinician who is only putting data for themselves, it will go directly into your page. So what you see on the landing page is the dashboard. So the first thing you see is your top 10 recently viewed patients. And because this is the test site, a lot of these are my name or just test. There's a work list item here of upcoming patients, so that's quite useful to look at. And then we have the things that you would expect. So you've got add patient, find patient, and these can also be found on the add and the search buttons up here. So these are just exactly the same thing, just in a different place. And the home button brings you back to this page. So first of all, I'll just show you how to add a patient, even though we would recommend that you would actually ask the patients to enroll themselves. But if for whatever reason you want to enroll all your patients instead of asking them to do it, that's completely fine. And you can do that through adding the patient here, or as I said earlier, pressing the button up here. So if you've got consent from the patient, they would be an identified patient, and then you can put in some information about the patient here. So I'll just put. So as you can see, I've put in a name of someone who already exists. So it will tell you this person exists. Are you sure? So you need to make a new person. So if it is the person that you're looking for, you can click that and then access their information there. If you do want to create a new person, then you can also create a new person, even if it's got the same name. So you just create a new person here, and it'll tell you then that this patient has not been consented yet. But if you've done it in person, then you can change the consent and say that consent has been given, at which point it'll ask you for more information about the patient. So I'll just put in some information here. And again, I would recommend that you put the email address in for the patient, because otherwise we won't be able to contact them with follow-up questionnaires. Okay. So I'll just create a new patient there. And that's the new patient created. So what I'm going to do now is I'll search for the patient that we just put in via the patient portal. So I think we called it, 2023 workshop. So I've just searched for 2023 and it's found the patient that we've just made in the patient portal. Now, obviously, I can only see this because I, as the patient, said that my clinician was Carol Crook. And now, because I'm signed in as Carol Crook, I can find that patient. So not all clinicians can find every patient. You can only find the patient that have been assigned to you. So now I've clicked on the patient and this is what we can see. So this is the landing page for the patient. It looks like there's quite a lot going on, but when you get used to it, you will be able to find things very easily. So patient detail, if you want to know more about the patient, you can put in some more information here or check their information. Pathway detail. So here you would probably want to add which side the patient is having their treatment. So let's say that it's right. And then you can save that. Okay. And once you've saved that, it'll bring you back to the first page for that patient. And what you'll see here is there's some blue headings. So under patient history, you can see that the patient's already filled in their self-assessment, which is what I did through the patient portal a few minutes ago. And you can also see that they have put in their BMI, or they put in their height and weight, which then calculated the BMI. And then you can see that they've filled in their scores already. So they filled in the EQ5D, KOOS and Kujala, as you just saw in the patient portal. You can also click on these and have a look and see what the patient actually answered. That can be quite useful. Or, for example, if the patient said, oh, I put something in wrong and now I can't change it, then you can actually change it for them. So if they, for example, they said they put in their weight wrong, then you can change that if you want. So you'll also see that there's future tasks for the patient. So before you as the clinician do anything within the portal, it'll just automatically say that they'll send something at 6 months. But once we've answered some of the questions, it'll then increase the number of scores that it will send out, as you'll see in a bit. This little button here is quite useful to know, the little mail button. If you find that the patient is running late, so they haven't completed their questionnaires yet, you can click this button, it'll send them an email just to remind them to finish their questionnaires. So now I'm going to move on to the two main questionnaires that you would need to fill in as clinicians. So there's one that's called the clinician clinical assessment, which is what you would do when you first assess the patient. And then there's a procedure or treatment form, which you would complete once you've done the treatment with the patient. So these can also be accessed from up here. So if you click pre-procedure assessment, that gives you pre-procedure assessment, which is the same as clinician's clinical assessment. I'm not sure why they're named differently in the portal, but perhaps we can change that if that's confusing for anyone. And you can also add the IKDC objective. This is an optional form that you can fill in if you want. So I'll just quickly run through this so you can see it is the validated form. And then you can save that if you want. So these two red forms are the ones that really should be completed by the clinicians or their delegates as well for each patient. So I'm going to start with the clinical assessment form. And one thing to note in the right-hand corner is the validation errors. So this tells you how many questions that are mandatory that have not yet been answered. So this will change depending on what answers we give in a moment, but it is very useful to see and just check when you're filling in the information that you have answered all the questions that you need. The assessment date is the date that you assess the patient, and this can be done retrospectively, so it doesn't have to be the same day. So we can say that was a few weeks ago. And then I'll ask you some optional questions about the patient's duration of symptoms. and whether they've had problems with other joints, and you can name the other joints if there are any issues. And then they'll ask you about previous history. So if they've had previous injections, you could say, yes, they had a previous HA injection, for example. And if they've had previous surgery, it'll then give you an option of how many surgeries have they had. At which point they'll then ask you what kind of surgery they had. So did they have a cartilage treatment surgery? Did they have other knee surgery? So if they've had previous cartilage surgery, you can choose whichever it is. If it is another, you can just click the other option. And if they've had other knee surgery, you can also write this. So it will also ask when did they have the previous cartilage and meniscal surgery. So this has come up because I've clicked that they've had a cartilage debridement and they've also had meniscal surgery. So we can just click this here, and then it asks whether it's medial or lateral. When did they have it? We can say that was the same month and year. And then it'll ask you what kind of operation it was. And if you don't know, you could just put other as well and just type unknown. And then it'll ask if the patient has suffered a cartilage injury. Did they suffer any other injuries at the same time? You might not know, they might have not had any, or they might have had another injury. So you could just put whatever is appropriate for that patient. Then there's a very quick question about leg alignment, so whether it's normal, excess valgus, or excess varus. And if you know the underlying cause of the defect, then this can also be added here. And this is an optional question because you might not know. But if you do know, then you can click whatever option. So here I've just clicked osteochondral defect cause unknown. If you know the onset of symptoms, they can be added, as well as the patient's activity level before they had their injury and before their treatment. So these again are optional, so you can click some of these if you want and if you have the data available. So that's all you need to do before the patient has their treatment. And now you've seen that the clinician's clinical assessment has moved from red to black, and it's moved into the patient history tab because it's now been completed. So what I'm going to move on to next is the actual procedure and treatment that the patient has had. So there are actually two different pathways for this. So we have a conservative treatment pathway and then a procedural treatment pathway. So the conservative treatment pathway is one that you'd fill in if your patient had a conservative treatment. And then the procedure treatment one is for injections or for surgical interventions. So we currently don't have the conservative treatment button in red here, but we could add that if it's easier for people to access that way, but you can click it here anyway, so it's not a big difference. So once you get into this, you can choose the date of intervention. So again, you can do it retrospectively. So say that you did it last week, you can say that it was done last week. And then it'll ask you what treatment was carried out. And then you've got a lot of different options here. So I did mention previously that the injection is included in the other form. And I would probably use the other form to complete injections because there's more detail there. But there are some injections in the conservative tab that aren't in the surgical one, such as saline, for example. So if there's something that's missing in the other form, you can just check this one and see if the injection is in the conservative one. So let's say that we've given someone a knee brace. So you've clicked application of a cast. So let's say it's the right one, and there's lots of different ones that you can choose here. So we've just put a knee brace, and these are all optional as well. So it'll ask you how long the patient's been asked to wear it. And if you want, you can add some information about whether it's outpatient or inpatient. And if you want to add more information about the brace, then that can be done as well. There is the option to add more detail or not, and I'll just show you what the additional detail is, just in case you're interested. So this will show you whether they've been referred to somewhere else, if there are any adverse events. And importantly, it'll ask if you want to trigger outcome measures following this non-operative treatment. So this is basically asking, do you want your patients to have questions sent to them after their treatments? So I would trigger standard review task set, and then the patient would then be asked to complete the questionnaires at the usual times that they'd be expected after their procedure. Okay, so now you see that the conservative treatment, because it's been completed, it's turned up as a black form here, office-based treatment of the knee. So now I'm going to show you the surgical side of things. So you can access this through this button. And I'll tell you a bit about default forms in a moment. So I'll click do not use as default first. If you're using the registry for the first time, and if you haven't set up a default form, then you won't see this page. It will go directly to this page. So this will ask you when the patient had their procedure. So again, that could be yesterday, and you need to confirm this. And the date of the procedure is really very important, because if you put in the wrong date, then the date that the patient gets their follow-up questions will be wrong. So if you just take extra care to make sure that that's correct, and then we know that the patients will be getting the questionnaires at the right time. So here I'll ask you if you want the data set only or the data set and the complete procedure record. You should have completed the procedure record already, because that is the pre-assessment things. Oh, I see Mike's raised his hand. Do you want to say something, Mike? Maybe not. Okay. So yep, so you can choose data set only or data set and complete procedure record. So as I said, some of the questions would already be answered if you've done the pre-assessment form on the patient, but if you haven't, then you can complete it now as part of this form. Okay, so you can see that it's already highlighted that the person's having a procedure on the right knee, and this is because we know that the patient has an issue on their right knee. So if this is incorrect, it'll say that it doesn't match the pathway, and if the pathway should actually be left, you can then go back into the patient and just change the side that it should be there, and then this will be correct. So it'll ask you about the opposite knee, so you can say it's abnormal if it's abnormal, or normal. And then it'll ask you some information about the procedure. So if you want to give it a title, you can, but most people don't. And then it'll ask you which hospital you perform this in. So we know that a lot of people perform procedures at different hospitals and different clinics. So if you do work at multiple clinics, you'll have multiple buttons here, and then you'll be able to put patients in the right hospital or clinic. So in this example, we've only got one hospital available, and similarly we've only got one consultant listed in this example. So if you work with a number of clinicians, then you could also have a list of other clinicians here. But if you're filling in for yourself, it'll be your own name that turns up here. And then it asks who the performing clinician was, so you can put information on whether it was unassisted or with assistance. So then it'll ask you to name colleagues if that's the case. But here I'll just put unassisted so we don't have to add in that information. So then it's asking about anaesthetic details. So what I'll do first of all is I'll go through an example of an injection. So let's say that they had local anaesthetic. And then for the approach, you can choose whether it was a primary or revision. So for the injection, we'll just have it as primary. And then we click injection. So then you get some optional questions on the EUA at outset if you do have this information to hand. And then there's some information about antibiotics and skin prep. So again, these are optional. So if you do have the information and the time to fill them in, then you can. And because we clicked injection up here, it's now opened some questions about non-surgical treatments. So here you can choose what kind of injection the patient had. And if I click on this, it'll then give you some options to give some further details. So what kind of HA injection it was, and you can give more details about the injection here. So let's just... And then it'll ask you about the post-operative treatment or follow-up for the patient. So you could say no brace, full weight bearing, and no physiotherapy after this. So I'll save that, and then it should save as a procedure treatment form. And what you'll see now is that the future tasks for the patient have changed because we've told the system that the patient's having an injection. So you can see here that they get followed up for 6 weeks, 6 months, and then annually up to 10 years. So now I'm going to go back into the procedure treatment form, and I'll just show you an example of a surgery. So again, it's exactly the same form to start. So check that the side's right, the knee's normal, and the hospital's correct, the surgeon's correct. And now they might have been under general. And you can put some more information about the ASA grade as well here. And so now I'll just change this to arthroscopic. And this will then change the questions that we have below to suit what we've written here, or what we've clicked here. Again, it asks you if you want to put EUA at outset. So it's got some additional information that you can add, as well as information about the antibiotics. And this time it'll ask you whether a tourniquet was used. This is optional information as well as the skin prep. So if you do have the information available and the time, then you can input that data. Again, there's information about the incisions, so you can put in some information about where the portals were and what instruments were used. And then we start with the findings. So these information on the findings are optional as well, but can be quite useful. So if you found that the fluid had pus in it, then you can state that there was, and then it might ask you some additional information on this if you have the information available. And you can do the same for the synovium. So you can say whether it was normal or if there was proliferation. And then it'll ask you where the cartilage damage or defect is. So this is when we're starting to ask questions about what was actually wrong and what was actually done to the patient. So here, let's say, for example, that they had patellar damage and trochlear damage. So this doesn't necessarily mean that you have to have treated both of these in this surgery. It's just telling us, we know this patient have this damage. And if you know the total area of defects, you can put that in there. So now it's going to ask us specific questions about the patella and the trochlear, because we've just told it there's an issue with the patella and the trochlear. So let's say that they're chondral, and we'll just click the containment and shouldered. And then it'll ask you for the defect size. So just type these in millimeters. And you can click then where the defect was on the patella. And you can choose multiple tiles as well, so you don't have to just stick to one. Then it asks you for the ICRS grade. And now it's asking you about the trochlear. So it'll be the same questions again for the trochlear lesion. Okay. And we'll say there's no osteophytes. And again, it's asking you for the size. So I'm just using this as an example. And now it's asking if there was any issues with the meniscus. So you can state whether it was normal or abnormal. If the meniscus was abnormal, then it'll ask you what the issue was. So let's say radial issue, and the hoops were intact. And then it'll ask you about the ligaments. So again, if they're all normal, you can state they're all normal. If there's an issue, you can say, for example, the ACL, maybe there was an issue with it. So perhaps it was absent or there's a complete rupture. And as you can see, if there's multiple issues, you can choose multiple options. And if there's anything in addition you want to write here about the findings, then you can do that. So now we are being asked about the treatment that was done to the cartilage. So if you remember back here, all the way up here, we stated that, oh, I think I've gone too far, but we stated that there was a patella damage and trochlear damage. So that down here, then you could say, I treated one area if you only treated one. So say that you only treated the patella, you can put the patella. If you treated both at the same time, then you can click that you did both. So I will do both for now and just show you. So let's say that we treated the patella and let's say it was cell therapy. And then you can choose then what type of therapy it was. So each of these will then determine what questions come up underneath.
Gwen, can I interrupt for a moment?
Yeah, that was so.
Sorry, I was delayed with a bit of an emergency, but thanks very much for your presentation. Ansar Mahmood, I think it is, has a question. Ansar, do you want to say what it is that you would like to ask?
Mike, would you like me to give him
yes,
the
please.
opportunity to talk?
Yeah.
Okay. Should be fine.
Ask away, Ansar.
Otherwise, it might be easier if you just sticks it in the Q&A box.
Yeah, maybe if there's some difficulty with your mic, you could ask your question via the chat, and I'll read it to Gwen. We did have a question earlier about if there are bilateral lesions being treated at the same time. I think you may have covered that, but if you could just highlight that again, that'd be.
Yeah, so you can, if you do bilateral, you can just add another pathway. So you can answer the same questionnaires, but for two different pathways. So you'd have one pathway for the left side and one pathway for the right.
Great, thank you. That's what I'd suggested in the written reply. We're waiting for Ansar to pop his question into the chat. So I'm sorry to interrupt. I'll come back to you when he's written that.
No problem. Yeah, so as I was saying, it'll then ask you some questions depending on what treatment you've chosen. So it might ask you about the scaffold then. And then because we've told it that we're doing 2 treatment zones, we'll then next click the trochlea. And again, we can say that we did the same thing, or we can say that we did something different. So as you can see, now I've clicked osteochondral repair, the options that we get are slightly different. So let's say that it was debridement. And then there's some additional information about the donor site if you want to give that information, and then the combined total area of the graft. And somebody recently asked if this could be calculated based on the answers that we give further up here. So you can see that we've already put in some information, and I think that's quite a good idea. So I am going to speak to Amplitude about that so that it automatically calculates that and you don't need to do it. So also we are aware that some people do additional surgery at the same time, so you can actually put that information in here. So if they didn't have anything else done, you can click that. and if they had something else at the same time, then there's also the option to add these. And as you can see, these are cumulative as well. So if they had multiple at the same time, then you can choose. So because I clicked osteotomy, then we had a question asking if it's DFO, HTO or something else. And because I clicked extensor mechanism, it's now asking what kind this is as well. And then it'll ask if there were any adverse events during the procedure itself. So you can say, yes, there were, or no, there weren't. And if you click that there were, it'll give you some options of what the intraoperative complications were. And if it's not listed here, then you can click other. And if there is anything that is missing that we haven't included that you would use quite regularly, then please let us know, because we can add buttons very easily. And it is possible that there are some things that we have missed. So yeah, if I've clicked back to no intraoperative complications, then it gets rid of the options to add complications. And then this is what we put earlier, and you can change these. So if they are being put in a brace, you can choose what kind of brace it is. And if they're not weight bearing, you can say how long they're not weight bearing for. And similarly, if you want them to have physiotherapy, you can state what kind of physiotherapy it is as well, and how many weeks they'll be having that for. And then there's some questions about VTE prophylaxis if you want to answer those. And again, those are optional. And this is the final bit, which you've already filled in because you've filled in the pre-assessment form already. So these are all filled in, and you can just check if you want that these are all correct, but they should be. Okay. So what is a nice feature about the registry is if you are doing certain procedures regularly, so if you're injecting regularly, or if you are regularly doing a certain type of surgery, you can fill in the form as I have today and then save it as a default. So I'll save it as a default there. And what that means is next time you have a patient, you'll be able to fill in the information much quicker, because when you choose the default form, a lot of the options will already be chosen for you. So if I go in here and now you see that there's two different defaults. So this workshop one is the one that we've just completed, and it's already filled in for you. So all you have to do then is check if the date's correct and just check that the details for the patient are right. So there are some things that you might not want to save as default, for example, the size of the lesion and things like that. But the general options about what type of procedure was performed can very easily be saved as a default. And then every time you go into the form, you know the options are correct and you don't have to manually click through them all. So the last thing that I'm going to show is how to generate reports, and this can be done by going back to the home page and clicking the graph bar at the top here. And this brings you into this page where you can generate your own report. So if you click create a new report, and then I'll make a name for it, and then click the pathway. So we've only got the knee pathway for the ICRS, so it's there shouldn't be any confusion of which one to choose. And then these are all of the questions that are asked within the patient portal and the clinician portal. So if you want to perform an assessment where you have certain demographic items, then you can choose the patient items. So if, for example, we want to know the year of birth of all of the patients that we've got, and perhaps we also want to know their BMI, then you can choose here that that's exported. And then you might want to know who or how many people have had shockwave therapy, for example. You can export that by clicking that. And if you want to know some scores, then you can drag the COOS score in here. And here you can see, you can choose each separate domain and the total score. Or if you're interested in particular questions, then you can choose to output these as well. So this is a very detailed reporting tool that you can use to literally report anything that you have or your patients have put into the registry. It is, because it's so detailed, it can be quite difficult to get your head around. So if there is something that you do want to export that you're having trouble with, then please get in touch with me, because then I can help you with it and set it up for you. So I'll save that. What this does is it tells the system, this is what I want you to report in an Excel spreadsheet. So now we've done that, I'm going to say I want to run it. So because I delegate for multiple people, I can run it as myself or as other people. But if you're a clinician and you're only working for yourself, then it'll just be yourself as an option. And then you can choose whether you run across the whole system, so all the patients that you've ever collected, or you can choose a start date and an end date. So say, for example, you only want to know the details of the patients that you've seen this year, then you can do the start date from the start of the year till today. So I'll just run it across the whole system. And then you press run now. And if I scroll up, you'll see that running reports is colored red. And what that means is that it's currently exporting the data from your registry portal into an Excel spreadsheet. So this can take a bit of time depending on how much data you're exporting. Obviously, if you're exporting hundreds of patients and hundreds of outcomes, it will take a bit longer. If you're only exporting, 3 patients and a couple of outcomes, then it will take much less time. So hopefully this will not be too long.
So Gwen, I think this really has answered Ansar Mahmood's question, because he was asking, can you extract and transfer data to other systems? What's the output, Excel or something else? So I think you have covered that. So we should be seeing an Excel spreadsheet, I think, with all that information.
So you can choose Excel or CSV format.
So Ansar, can you just give us a thumbs up if that's answered your question, or if there's anything further that you'd like to know?
So what I've done now is I've just gone to the completed reports tab, and this will show you the reports that have been finished. So you know that the report's been finished because the red bar has changed and there's now a blue bar to say that. So I did one earlier, which is why it was at 1, and now I've done 2. This is my second one today. So it's telling me that report's been finished. So if I go to completed reports, I can then see what I've done today. So I did a test today earlier, and I've just done the workshop one. And if I download this, it'll just give me a warning. There might be patient identifiable data in this. And then it will then download the spreadsheet for you. And then you'll be able to open it within Excel. I don't know if you can see this screen, because you're probably still seeing new share.
Yeah, it's not visible. There you go, it's there now. Thanks.
Yeah, so because this is a test system, it doesn't have a lot of data in it, but what you can see is what I've asked it to export. So it has the date, which is actually visible. It just doesn't come up in the format in Excel. And then you've got the BMI that I've asked it to export, and the COOS scores. And you can see that it's exported the COOS all the way up until 10 years, because that is what the registry does. So that is basically it in a nutshell. There are lots of other, if you have got lots of other questions that you have about the registry, then we can answer those now, hopefully within the next 10 minutes. Or you can email me as well. I'm happy to talk you through things one-on-one, or help you with anything that you need with regards to putting your patient data in the registry.
So we have had a few more questions. Vicky Jones has asked something about the reported outcomes that are collected. And this is being recorded. And so I think the easiest thing to do would be to wait for us to upload it onto the website, and then you'll be able to watch where Gwen's already been through that, Vicky. And then Rustam Kamko has asked whether a CD or C-disc format is also available. I'm not sure what you're asking there, actually, Rustam. So if we can we get Rustam on to be able to ask his question?
Yeah, I'm trying to.
Thanks, Anouk. While we're waiting for that to see if it's... Oh, here we go. So Rustam, if you unmute yourself, hiya, you should be able to ask Gwen directly.
Yeah, thank you so much for the informative session. Actually, I have a question regarding the exporting. Is it possible also to export it like in C-disc format, which is international standard, where you can share the data with other for statistical proposal, you know?
I'm not sure. I believe that it's only in CSV and Excel formats, but I'm not sure if CSV is compatible with what you were asking about. I can ask Amplitude, because they're the ones who've set up the exporting system. If you're finding that it's impossible to align the CSV or the Excel with whatever software you'd want to use, then we can look into adding that as a function for you.
Okay, thank you so much. Thank you for the clarification.
Then Konrad Slinarski from Poland's asked whether it'd be possible for him to migrate his patients' data from another registry. I don't know if you want to cover that, Gwen.
So we can't pull data from from one registry to another. We would have to export the data from the other registry and then import it into our registry. So that's done. Usually we do it with a pro forma if it's retrospective data, and if there's a lot of it, that we would ask Amplitude to help with putting the data online. But it depends on how much data there is and whether it could be done manually.
So just to cover that from a slightly different perspective, Konrad, we have, during COVID, we were able to continue growing the data that we have, because we've had quite a few of the guys off the general board and busy surgeons around the world from the ICRS who've kindly donated historical data. And the way that that comes out of your registry system is in a certain order of columns and rows. We know our data collection system, the screen version and what lies behind it is called a schema. So aligning the schema of your registry data to the schema of the ICRS registry is perfectly possible. That can be quite labor intensive the first time round, but it can be set up as a macro. So we can have different potential ways of collaborating. One being that intermittent periods, you do a data dump and download from your other registry. Or if, for example, you're using a registry that's becoming obsolete or is being closed down by the people that were running it previously, and there's been a few of those with some recently, then as long as you get your data exported out of that into a schema that is recognizable to you, then we can work together to be able to have that schema aligned with the ICRS schema. And then moving forwards with the appropriate permissions from your patients, we can continue your long-term follow-up if that's what you would prefer. I hope that's answered your question, Konrad. Maybe we could, Anouk, can we bring Konrad on stream so he can ask any questions? Thanks. Hi, Konrad.
Hi, how are you? Can you hear me?
Thank you. Yeah.
Yes, we can.
Oh, thank you very much. It was a very interesting webinar. Thank you for letting me speak. Yeah, I think Mike, this actually answers my question. I think I can extract the data. It's actually about 6 or 7 years of collecting patients' files. So I assume it's going to be a big number of data. So yeah, I can probably, I don't know how we can move with this, but I can easily extract this as an Excel file or another types of file that you can tell me.
That's a fantastic offer, and that'll be a massive contribution to increasing the ICRS registry's data. We can speak offline about that, and we will be able to make that function for you. And if you wish, then we can take over, and you can use the ICRS registry moving forwards for your sort of front end data inputting for new patients and follow up. Or if you want to intermittently data dump, once you've done the hard work once, then it's a straightforward macro for any future transfers of data. So that's a really generous offer. Thank you very much.
Yeah, thank you. I'll get in touch with you after the event, and then maybe we can chat offline about this and get it sorted.
Great, thank you.
That's good. Thank you. I'm not seeing any other questions, so I'd like to first of all apologise. I was stuck with a clinical case that meant that I wasn't here to introduce Gwen, but she's done a fantastic job explaining things so clearly, and I think we can all see how straightforward it is to use the database. We are using it regularly, and once you get used to it, then it's really quick, particularly if you're doing the same type of procedures, which most of us tend to do. Then with that memory possibility, all you do is change the size of the defect and the date, the name of the patient, and pretty much everything stays the same. But if anybody has any further questions, then we can answer those with you directly offline later. There might be a couple more here. Okay, yeah, there are some further questions. So I'm not seeing them on here. So if we can have Wilco de Jong, Anouk, can we bring Wilco on?
Yeah.
First, if that's okay?
Checking if, yeah, hold on. Yeah, Wilco, you're in.
Hello.
Hi, Wilco.
Oh, my video isn't working. Yeah, I've got a brief question about the EQ5D. I saw that it was in the registry, which is great, but small question, is it the 3 level or the 5 level?
Well, I think it might be easiest if you just, can you show us that if you do a screen share and showing which particular EQ5D variant we're using? And while we're doing that, is it Nele, I think maybe?
Correct. Yeah, I'm trying to, yeah. Nele, yeah. Can you unmute yourself, Nele?
Hello?
Yes, we hear you.
Okay, perfect. No, I just have I missed the beginning of the presentation, so maybe this was explained already. I was wondering if for baseline, the patient also completes the questionnaire, so before the treatment is performed, or is it only after treatment?
Yeah, they're encouraged to do it beforehand. So what we recommend is that you ask the patient to enroll themselves as soon as you've met the patient and know that they're going to be having a treatment. So they would enroll themselves, and as part of that enrollment before their treatment, they get asked the baseline questionnaires.
Okay, yeah, great, thank you.
The whole presentation is recorded, and so you'll be able to watch that in real time very shortly. It'll be uploaded onto the ICRS website, Nelly, so you'll be able to get the full benefit of Gwen's explanation earlier. And if that's insufficient, just give us a shout and we can go through it on a one-to-one. So Gwen, I don't know if you've had time to bring up Wilco's question.
Yes, I'm not familiar with the two different formats, because I thought the EQ5D was the 5-dimension. I didn't realize there was a third.
Oh, I see that it is a 5 level. There's 5 boxes. Yeah.
It was. Oh, okay. I see what you mean. Okay.
So
yeah.
thank you, Gwen.
Okay.
Okay, that's great. So I think in the absence of any further questions, I think all that remains is to say thank you to everybody who's been kind enough to give us their time. Thanks to Anouk and the central office people who've done a marvelous job of bringing this together. And most of all, thanks to Gwen for such a fantastic job that you're doing as the registry manager and for explaining things so clearly to us all today. So I really appreciate everybody's time. Thank you very much. And we hopefully see you at the ICRS somewhere soon. Okay. All the best. Bye-bye.